Assalamualaikum everyone, welcome back to my YouTube channel। अब हम बात करेंगे chemotaxis of leukocyte। After existing the circulation, leukocyte move in the tissue toward the site of the injury by a process called chemotaxis, which is defined as a locomotion along a chemical gradient. Both exogenous and endogenous substances can act as chemoattracts, including following bacterial products, particularly peptides with an formylmethane termini. Cytokines, especially those of the cytokine family, component of complement system, particularly C5a, products of the lipoxygenase pathway of arachidonic acid A, metabolites, particularly leukotriene B4. These chemoattractants are produced by the microbes and by host cells in response to infection and tissue damage, and during immunological reactions, or act by binding to 7-transmembrane G protein coupled receptor on the surface of leukocytes. Signal initiated from these receptors activate second messenger that include the polymerization of the actin, resulting in the increased amount of leading edge of the cell and localized or myosin filament at the back. The leukocyte move by extending filopodia but pull the neck back of the cell in direction of extension, much like the front of the wheels pull an automobile with front wheel drive. The net result is that leukocytes migrate toward the inflammatory stimulus in the direction of locally produced chemoattractants. The nature of the leukocyte infiltrate varies with the age of inflammatory response and the type of the stimulus. In most forms of the acute inflammation, neutrophils predominate in the inflammatory infiltrate during the first 6 to 24 hours and are gradually replaced by the monocyte-derived macrophages over 24 to 48 hours. There are several reasons for the early preponderance of neutrophils. They are more numerous in the blood than other leukocytes. They respond more rapidly to chemokines, and they may attach more firmly to the adhesion molecule that are rapidly induced on the endothelial cells, such as P and E selectins. After entering tissue, neutrophils are short-lived. They undergo apoptosis and disappear within 24 to 48 hours. Macrophages not only survive longer but also may proliferate in the tissue and thus may become the dominant population in the prolonged inflammatory reaction. There are, however, exceptions to this stereotypic pattern of cellular infiltration in certain infections, for example, those produced by Pseudomonas bacteria. The cellular infiltrate is dominated by neutrophils for several days. In viral infection, lymphocytes may be the first cell to arrive. Some hypersensitivity reaction and are dominated by activated lymphocyte macrophages and plasma cells, reflecting the immune response, and in allergic reaction, eosinophil and maybe prominent cell types. Molecular understanding of the leukocyte recruitment and migration and have provided a large number of potential therapeutic targets for controlling the harmful inflammation. Agents that block TNF, one of the major cytokines in the leukocyte recruitment, are among the most successful therapeutics developed for chronic inflammatory diseases, and antagonists of the leukocyte integrins are approved for the inflammatory disease and are being tested in clinical trials. Predictably, these antagonists not only have the desired effect of controlling the inflammation but can also compromise the ability to treat the patient to defend themselves against the microbes, which of course is the physiological function of inflammatory response. देन हमारे पास आ जाती है इसकी समरी। ल्यूकोसाइट्स आर रिक्रूटेड फ्रॉम द ब्लड इनटू एक्स्ट्रावास्कुलर टिश्यू वेयर द इन्फेक्शन pathogens or damaged tissue may be located, migrate at the site of the infection or the tissue injury, are activated to perform their functions. Leukocyte recruitment is a multi-step process consisting of the loose attachment to and rolling on endothelium, mediated by selectin, firm attachment to endothelium mediated by interagrins, and migrate through the endoepithelial gaps. If you have any query regarding that, can ask me in the comment section.